Hello everyone. I'm Mavish and I'm back with another live session, an interesting live session. I have a very special guest tonight, and her name is I don't know. I would have to introduce her as well because her reputation precedes her. Basically, um, she's into family practicing and she's into skin conditioning. She's into general practicing for the families. So we're basically talking about medicine, and we're basically also talking about medicine consulting. So I think let's wait for our special guest to join in. So yes, let me see if I can add her right now, doctor. We would have. So, this is a live session that I got a lot of DMs, and a lot of people were asking for it. Different because since I've actually started venturing about mental health and the importance of mental health, particularly women. So, this person, she's my long time friend. We date back to almost like school days, and yeah. So I need to just add her up. I don't know. I can't find her Insta. Seriously. Sometimes this Insta gets the best of me, but hold on. Okay, so um I can't really find her, so I would just have to call her first. Okay, I hope everybody is fine, and I hope everybody is doing great. I hope everybody has had a great New Year night, and I also hope you guys have your New Year resolution right thought out, and the plan is laid out. So so there was, so I think what we would need to do is that we'll just catch up with Dr. Anushe Usman. She is basically, before she joins us in, I have sent her the invitation. So she's a dermatologist, a consultant, and a family practitioner, and she's got her studies done. She's got her medicine and her degree done also from University of Cardiff, and also from in Pakistan, I mean Lahore, Pakistan. So I would leave the rest of the introduction, I would leave actually for her to talk about, because we have loads to talk about. This session has been arranged. We had to talk about anxiety, depression, and how to overcome such common causes of these conditions, basically. So yeah, so we'll just have to talk it out everything. So if you have any questions, you can also let us know in the comments, and also you can also let us know in the comments, and also you can write down a question if you want to ask, and we'll include that question in our discussion here. So I yet have to. Yes, I hope she's online, and she is. Wow. Okay, so I think Anusha has joined us, and she's actually joined us in the live session. There you go. She's joined us. Okay, cool. We'll just wait for her. Oh, there you go. She
Hi.
is right here.
Hey,
Hi,
hello, Lord. Yes, I'm good.
well,
How are you? I'm sorry, I had like a little glitch, somewhere.
yeah, I know. This is my first doing live with a guest. For so I hope, I apologize if there's any technical difficulty here. So, how are you?
I'm good. I'm good. How are you?
Great, great. So, before you joined us in, I actually kind of did give a very brief introduction. So, why don't you just start off and tell us a bit about yourself? I know we're talking after like decades, but still, let's just have your introduction first, and we will discuss what we are really meant here to do.
Sure thing. I'm basically a Lahore-based doctor, and I'm a consultant dermatologist and a family practitioner. And I did my qualifications from Royal College of General Practitioners, MRCGP from UK, and my specialization in dermatology from Cardiff as well. So my main dream was to give awareness to people regarding healthcare issues which are usually not talked about, and even other healthcare issues, because there's so many things that people which are very common ailments and problems, but people don't know much about them, and all they can do is Google, which gives you a lot of anxiety. So I would want to
Exactly.
have a platform.
A little
Exactly. So I would want to
anxiety.
have a platform.
Yes.
So we want to have a platform, obviously, on which we could at least, give awareness to people regarding basic healthcare issues. So they know where where they can go and what kind of help they can seek. So this was my main motto, and thank you, Mavish, for being there and helping me out, reaching
Well,
people.
thank you so much for being here with
Most
us,
welcome.
actually. So, a lot of people are joining us. I'd like to say hello to everybody on board with us. I hope more and more people could just join us and listen to this, what we have to say, since we're discussing some of the most common and sought out topics that we don't really openly discuss, not even with our friends, not let alone our
Yeah,
family. So,
true.
Anusha, I hear you are also along with a professional and a doctor, you're also a mom. So how does it go about? How do you balance both the worlds? Like, being a mommy and also being a doctor, because being a doctor is pretty demanding, especially when it comes to the well-being of your patient. How are you managing work-life balance here?
It is indeed a roller coaster ride. Every day is a big challenge. But like I take every day as it comes by. I don't really plan days and months ahead of time. Because you can't really predict things when you have like small children. So I think that's the
Of
right attitude, because if you think a lot before time and then things don't turn out the way they should, then it gives you a lot of stress and anxiety, and you might end up having depression. So I take the days as they come by, just plan slightly ahead of time, and a lot of organization. I need to be very organized about how my days should be, how you know exactly, with kids education and looking after kids. So it's very challenging, but then you need to make your priorities. You need to prioritize what is your ultimate priority. So
effective.
exactly.
Yeah.
So yeah, it is hard, but I think it's not impossible and not unachievable. And if you're like doing not like extremely outstanding in every field, if you're doing more than mediocre in everything that you do, I think that's sufficient enough. We should uh, yes, we should be able to I think address to all our problems, and cater to all our commitments.
Yes, and cater to them. True, true. So,
Yes.
the most commonly that I was DM'd actually, since I'm actually going through it myself, to be honest.
Yeah.
So
Yeah.
it is, we have some anxiety and we have some depression due to the seasonal changes around us. So, tell us about this. What is seasonal affective? What is this condition? Why would people
Mm,
feel sluggish all of a sudden, and why would they feel depressed? Why would they feel so much down despite of having everything around them? Is it just
mm.
a winter, or is it just any other season? Just tell us a bit more about that. So, yeah, about this condition. Yes.
Right. So basically, normal people would not even know about this, that this thing actually,
Yes. They
exists, and it's actually a medical condition which is called the seasonal affective disorder, or SAD, which actually makes you sad, but it's basically an abbreviation for the medical condition, which is the seasonal affective disorder. So what happens is, like, with the change of the season, certain seasons people are more susceptible, but I know people who, for various reasons, they have this condition in springs as well, or in autumn. It's pretty common. This is
Okay,
the
so
second
can
most
be
common
any
season.
season.
Any
It's
season,
not
yeah, but mostly it's winters. Mostly
for
it's
me.
winters, yeah.
I
Yes,
don't
for
like.
most people it's winters, yeah. So for most people it's winters, and what happens in winters is that when climate is changing, things are becoming really gloomy around. Like when you look, the sun is less, it's more foggy, more dense, and things are little grayish. So what
Yeah,
happens is, like, it has an impact on our brains, and some
it,
people who are more prone to have this, yeah,
yeah,
they have
yeah.
certain chemical changes, so which makes them further depressed during this season.
True,
So
true.
this is called a seasonal affective disorder. It is usually, it comes and goes. It comes with the season, by with the season, stay there, but at times, with people who don't seek help, it tends to stay and turn into major depressive illness, right?
Yes,
So, which is,
yes,
yeah,
exactly.
so,
So I have Mr. Aves. By the way, hello everybody. Rida, Anya. I've seen so many people joining us. So I've had comments about, from Aves, basically, that since he's living in Dubai and there's no change in season, but he still goes through big swings in the mood. So is it what is really like seasonal affective disorder? What would you say to this,
mood,
Anushe?
mood, yes, mood swings can be an alarming, an alarm which is ringing around, which may be, like, if he is, what do you mean by, like, exactly mood swings? Is that probably you are fluctuating between depression and mania? That's a different
That's
thing, which
right.
is called, yes, that's a different thing, which is called a bipolar. That's a different
Oh,
diagnosis that you might need to give
that's
somebody,
different.
right?
Okay.
That's
So,
different. If somebody's swinging between,
Anushe,
depression and what? Pardon?
this is not that of a so when you say bipolar, is it like of a very severe nature? Is there some I mean, do you have to see a doctor or a psychiatrist for this, or a therapist for this? What exactly is the nature of the condition here?
So, for bipolar disorders, you would always need therapy. Even for seasonal affective disorder, you would most probably need therapy as well as medication. See, so there are two kinds of treatments with psychological and psychiatric illnesses. Is that you might need a person who's a psychologist with whom you can talk, and he can give you different therapies to overcome that condition. Who would give you certain exercises, certain breathing exercises, certain activities to do. So a psychologist would give you an oral therapy, right? Would give you
Okay.
would talk to you about it, and would take you out of that, and would give you a new some neuro linguistic program or something. Even hypnosis is part of the broader
Getting
spectrum.
yourself busy, getting yourself busy, getting yourself involved in
Yes,
more constructive
yes,
activities.
yes,
And I think,
yes.
Anushe, I mean, I'd like to point out to everybody, because every person is going through some form of a condition
Yes,
here, be it anxiety, be it some depression, or what. We don't want to we don't want to term this as like a really as an illness, but there is a condition. And rather than kind of आप परेशान हो जाओ कि हाय मुझे तो ये हो गया, you need to kind of share it, you need to kind of recognize it, because first
yes,
step to resolving a problem is actually to recognize that there is one, right? अगर आप ऊपर
yes.
से गुजार दोगे कि नहीं, it's just seasonal, and because मेरे साथ ये होता था, I had put this off so long कि it started affecting my personal life, it started affecting my professional life, and I was like, why am I so lazy? I'm charged with energy, I'm working for 18 hours in a day, but why all of a sudden am I going down? So I recognize that there is a problem, and I wanted to reach out to a professional, and I wanted to reach out to to somebody I can trust actually, so that आप किसी से confide करके इसको आगे लेके चलते हो. So
Hmm.
all of us who are going through a certain condition, I think this live session is about coming forward and discussing what you're really going through and getting professional help if needed, guys. You have your support group, you have your friends, you have sometimes but आपको लगता है कि आपके साथ कोई भी नहीं है. You're practically alone. So don't think like that. You have a certain support group for you to rely on. So
Hmm.
having said that, Anushe, we've discussed that seasonal affective disorder, SAD, is a condition now that not many people recognize, but it exists. Sometimes it exists in winters, sometimes it is existing in any other season. So
Hmm.
being a doctor, because I saw on your Instagram you also posted that as a doctor you try to kind of give a very positive vibe to your patients, and you kind of listen
Hmm.
to them, because
Hmm.
these days people are already too depressed when they come to the clinic anyways.
Yes.
So recommend is the best go-to solution, or the first step towards making this go away, basically, or reducing the impact that it does on your body and also on your mind?
Yes. So the first thing that you would want to do is first is recognize that you're going through something which is different and which is not, it's not the regular you, you know. So what happens is that you need to recognize, and mostly what happens sadly is most of the people fail to recognize even themselves. You know, the changes that are happening in them, they fail to recognize them. So we need to keep an eye on people who are close to us, like our friends, like family, like cousins. You know, we need to be responsible citizens and people, you know, and we need to keep an eye on people around us, you know. So it's not necessarily that the person himself would come and seek help. You can come and seek help for your cousin or your friend or your,
Keep
spouse,
checking
you know.
people around you. Yeah, yeah.
Yes, so you need to keep an eye on this, because exactly, because such people do not really are not really self-conscious about what they're going through. They might be going downhill, they might be feeling depressed, they might be feeling lonely, don't want to share things, because this is one of the major things is that they don't want to share things when they're depressed. They would want to keep it to themselves, you know. They might keep a diary. So, you know, you should just keep a track or keep an eye on the behavior of that person. Like maybe it's your friend or your cousin, she's behaving unusually, even slightly. You should talk, you go ahead and feel free to talk about it. And people who are suffering from this should, I think, do not hesitate, and, speak to your friends first. And always, I must insist, you should always seek medical help, because people who just do not seek medical help, they might end up in wrong hands, and then they're not
Society.
diagnosed properly, and then they have severe forms of depression, which can eventually lead to suicide. So which is, it's extremely important that we should raise the red flags of the mental health. So I think you should seek out to a doctor who's close to you, like a family practitioner, because very few family practitioners are there. Family practitioner can cater to all kinds of problems, like from childhood, even, these anxieties and depressions, they exist in the childhood and adolescence group as well. That is, yes, and
Yes.
sadly, this is the main thing that we just overlook all that. Small kids these days have a lot of anxieties. Adolescent boys, 13-year-old, 14-year-old boys, maybe they're going through something psychologically or physical trauma somewhere, and or there are parental fights going
Yes.
on. They
Right.
can't share things. So these people do tend to be facing a lot of anxieties and depressions. Children do fall into depression. So
True.
we need to be we
Getting
must seek medical
professional
help.
help is one. So getting professional help is one, but that you
Yes,
recommended, like
yes.
see your family practitioner, see your any nearest family
Mhm.
practitioner, somebody that you can
Yes,
really trust. So Anushe,
yes.
what are your everyday? What is that? What is it that in our everyday lives can we do? Can we adopt a certain habits to kind of help us keep this condition at bay? Like, could it be just मैंने भी explain किया. For some people, exercise helps them a
Yes,
lot. For some people,
yes,
watching their
yes.
favorite show. But then, like me, if I would watch my favorite show, after some time, it comes back, like sometimes I
Yeah.
would feel so sluggish and I would really don't want to get up from my bed that,
Hmm.
and then, I can't watch my favorite show then because I don't feel like it. So,
Hmm.
what do you think are tried and tested therapies, home,
Hmm.
because with
Yeah.
COVID, of course, not
Yeah.
everybody readily accessible, or not everybody is able to go and see the doctor. So what do you
Hmm.
what tried and tested therapies that you recommend, as that you would recommend your patients? If you could just guide us into one or two, so that would be great.
Yes, they won't be like full blown therapies, because for that you must see your doctor. This is like in any case, you shouldn't rely on anything that you can do at home. But there's few exercises that you can do. For example, you do not set up a monotonous routine. For example, like you said, I've watched my favorite show. So if you're watching the same thing over and over again, that will bring you back into the same monotonous routine, and your chemicals will, again hit the same level. So what you need is you need to motivate yourself and keep, like accelerating yourself, on and
True.
off. You need to accelerate like you accelerate a car, so that it does not.
थोड़ा बहुत
Yes.
change, like
Further
थोड़ा बहुत
change,
walk.
like if you're watching one season, so you can change, because before it gets monotonous, you change it, yeah. Or what you do is you set up your room in a very, very bright colors, or brightly lit room. You should have a very brightly lit room. Don't go for dark lights. Yes, don't go for dark lights. You should have like a very bright room, and you should set it up with like bright colors, or like the fine colors. Don't go for like earth tones or grayish tones, like blackish tones. Don't set your room into that. Something that would soothe and calm your senses, like light blues and light greens, and something with like very the bright lights would, bring it up. Secondly, there's
Bright
certain
light.
foods that make, yes, and certain foods that make people happy. For example, ice cream. It has a very good effect on people who get depressed. Even in winters, when they have ice cream, there was a research that I was reading, that people have, a perk in their, mood elevation. So it's very good. Also, like aerobics exercises, which increase your blood circulation. Yes, that yoga. So there's different techniques, breathing exercises, so there are different things that, help people with seasonal affective disorder. I know people who have this disorder, or who suffer with gloom during autumn. In autumn, because they feel that the leaves are falling, and that's the ultimate cycle of life. So it reminds them of death. So that's why.
The loss of hair, the
Yes,
loss
there's
of,
a lot of.
yeah,
Exactly.
true.
So the trees are getting nude, the leaves are falling, and it's kind of a subliminal, message that is conveyed into their minds, that it is, this is the eventual life. So, they become gloomy. So August is also another autumn, in fact. Um, so lively colors would make you feel light. So what happens is always give positive hopes to people, and people, if somebody comes to you, like your friend or somebody who's feeling depressed, never say that, oh, this happens to me. This is the worst
Yeah.
you can do to a person. You should say, I
Yes.
understand what you're going through, and I think you should see a doctor, or I will take you to a doctor, rather than saying that I'm feeling or I'm suffering through the same phase as well, because that person is trying to look for comfort in you. And then if you tell that person that you are going through the same thing, they might look away, and they might look at nobody else around them. So this might make them worse, right? So even if you're going through the same phase, never say it to the other person that, like. So there are a few
No.
things that we
Not
need
let
to,
let the other person
yes,
decide what they're going through. Let that other person
yes,
confide or talk about it,
yes,
rather than
yes,
and you kind of doing it a pressure. I think that's a very good social tip,
yeah,
because we tend to judge very
yeah,
easily. We
yeah,
are also not at the giving end, we are also at the receiving end
yeah,
as well. So
exactly,
somehow when people feel judged, then that's when it's stopping them from talking about what they feel. So I think the
no,
first step is towards this catering to this condition is to not to pressurize people into thinking that they have a certain
yes,
condition, but also let
yes,
the other person let the other person empower that person basically to talk about the condition themselves
Yes,
rather than to do
yes.
it on. So I think that's.
Uh,
But
we can be on
tell me
the
about,
listening end. We
yeah,
can be on the
please.
listening end, right? We should be on the listening end very readily. We should, talk less and think, listen more to that person, and then eventually we can, help that person decide if he would want to have medical or psychological help. And I think we can't force somebody, but at least we can guide them, chaperone them. That is the right word. We can chaperone
Chaperone.
them. Yes, that
If
person.
they're doing fine and if they're able to kind of be okay with themselves. So I understand that. So I think there are a lot of people who are already watching us. Thank you so much, guys, for staying live with us and for tuning into this live session. Thank you so much, everyone. So just as a recap, we've discussed our very well implications of seasonal affective disorder, a condition that prevails in people due to season, basically. So that includes lethargicness, that includes tiredness, and also includes somehow it can escalate to a certain level, which includes panic attacks, which includes anxiety attacks. And I got a lot of DMs saying that this is a condition that they are going through, and they want people to openly talk about it. So that is why we have Dr. Anushe Usman with us right now, and she's guiding us into how to seek professional help as well as staying at home and making use of certain remedies that can actually kind of alter your routine and make you feel a bit better, basically. So Anusha, there's a question. There's also a question. I mean, I'm sure you've gone through a real life struggle of being a doctor because we were in school together. So I always saw you as a very bright, talented student, and we knew that you would be going places.
Thank
Mashallah.
you.
So how आपका अपना personal experience इस condition के बारे में, या you're dealing with a lot of patients as well, what would you say to your personal experience? Have you ever experienced such a condition before, and if you did, what was it that kind of made you kind of over help you overcome it, basically?
Did I feel depressed at any point in my life? This is what you want to ask?
Yeah. I mean, this SAD's condition,
Yeah.
I'm sure if if
Yeah.
anybody can go through, so probably you could have gone through at some point in time. So if you
Yeah.
went through it, then what did you do to kind of overcome it and come out of it,
Right.
basically?
Right. So basically, what happens is that everybody, I think everybody in their lifetime, once or twice or maybe more, might be facing this condition, and it could be anybody. Anybody can face this condition, and I think almost everybody in their lives, once or twice, does go through this traumatic experience or go through certain environmental changes or changes in your life which make you depressed. So yes, I had to go through certain situations in my life, and I was really really depressed and down, and I thought I was worthless and not doing enough. But then you know what, there was one thing that one of my friends and a mentor, she told me that the first person and the only person who's ever going to help you is yourself. You do
True.
not seek help from anybody. Don't expect anybody else to help you. Yeah. So this is the first thing that you should write on a piece of paper and stick it on your wall, that the best hand to find a helping hand is the end of your own arm. You
So
know,
agree with.
that
Yes,
is the
yes.
best help. So yes, so you need to put yourself together, because for your betterment, think of the pros and cons. Because if you go downhill, it's all going to be bad and messy and negative for you. And if you want to go uphill, it might be a struggle. You might take a few years. It's going to be hard, but then at the end, the view is always better at the top. So you might end up, you keep just take your steady steps.
Yeah,
Don't set a very very high targets initially. Go phase by phase in your life. If you're going through any problems, tackle problems phase by phase. Don't think like years ahead of time. Nobody knows, nobody can predict. Live in the moment. Not like just like living in the moment and not planning anything. You should have like plans and secondary plans. If this goes wrong, I can do this. If this goes wrong, I can do this. Don't be rigid in your thoughts, because if it's rigid, anything that's rigid, that breaks. If it's a rigid tree branch, it will break. If it's a rigid, anything that's rigid, it's going to break. So if your thoughts are
True.
rigid, your thoughts will break. Your mind will start shattering.
Exactly. And then, you don't want to kind of undermine yourself and,
Yeah.
self and having self-doubt about yourself every now and then. So, just take it lightly, take it as it comes, and then, you'll be
Yeah.
fine. That's a great
Yes.
tip. I've got certain people, I've got Nazia, Madiha rooting for us. They think that it's the right topic to discuss.
Thank
Sajad
you.
here thinks that my red color is helping him go live. So, I mean, thank you
That's
so
good.
much.
That's awesome.
Cute. So thank you guys for appreciating so very much. If there is any question, Anushe and myself, we are live with this session with so much because this is like so much to discuss. We've started this initiative, and you would see more of us coming live with very important topics that are left unspoken for, especially for women, because we understand that we as women, we want to let ourselves go, by the way. We want to
Yeah.
kind of make sure that our families are doing okay. We want to make sure that our professional life is going strong, and also our friends are doing okay. But sometimes we forget to ask ourselves, are we doing okay? So this is for all those women out there, and you guys are not alone. And you guys, just like Anusha said, you are the only person who can help yourself. No one will actually come up to you to rescue you, and to make sure, and to tell you that you're fine. So support group की अलग बात है, and doing it yourself is actually a whole entirely on a different level here. So I think we have a lot of joiners here. So yes, I'm just kind of going through if there are any questions. No, we don't have any questions right now, but I think we are being discussed. Thank you so much, Madiha. I love you. She's my best friend, and she is always there. And I have Rida. Rida has comment for both of us, Anusha, you and me, that she is excited to see both of us together. And
Wow.
yeah, I think good. So you also mentioned during our initial discussion that we'll just go for 10 more minutes and then we'll wrap it up. So you also mentioned that there is some impact of COVID, actually, because a lot of people, they kind of take this for granted, but it's actually impacting on our physical and mental health as well. कोविड के हवाले से जो लॉकडाउन्स होते हैं या एक फेयर होता है कि ओह कोविड इतना हो रहा है, इतने सारे लोग जो है वो बीमार हो रहे हैं, सारा कुछ. So what do you have to say to this situation?
Yes, I think this is the most commonly occurring problem these days due to COVID, but it is the least talked about. I think it's hardly being talked about anywhere,
Yeah.
neither on social media or on regular media. But people who are prone to mental illness or who are already prone to getting seasonal affective disorder or any other depressive illness or any other psychological problems, after the COVID, their conditions have become worse. This is because of a couple of things which I would like to mention over here. First is the lockdown, as you mentioned, because when the initial lockdown happened, nobody knew what to do, how to tackle the situations. They did not know how to go to the doctors. They feared going to the clinics. They feared seeking help. So one was this. The other thing, which is still presently being experienced by people who come to me and post-COVID, is that the post-COVID recovery as well as the during the COVID, the psychological impacts that they have. The first thing we do is a person who is depressed, who is going through probably it's a winter season, so they have an SAD going on, or a person who has a major depressive illness, we
True.
isolate that person for 14 days. So what do you expect would happen for a person who's been isolated for 14 days and who also has depression? How can the
Yeah.
family ensure that he's having his medicines on time, or how can you ensure that you can talk to that person, or he can't even come out of the room or the particular area that he's been confined to? So that rate of depression is increasing in certain people who have COVID, and people who do not have depression otherwise as well. When they because the kind of material they read on internet and on Google and everything else, COVID is itself is a big mental stigma to anybody, because you don't know what's the outcome.
Yeah,
Exactly.
true.
You don't know what's the outcome. So anybody can fall into depression or stress or anxiety. So this needs to be catered. Like it's very easy for anybody to say that fine, isolate this person. But a person who's already suffering from depression, how do you isolate that person? And if you isolate that person, how do you keep an eye on that person? So the thing
Yeah.
is that if you have a family member who also has depression and has COVID at the same time, you need to keep an eye on that person.
Because a lot of people are actually also prone to such tendencies, like if they
Yes.
are held back, who's actually suddenly gone through a big major setback, जैसे अभी कोविड में
Yes.
काफी businesses भी लोगों ने खत्म किए
बिल्कुल
हैं अपने, they have
बिल्कुल
lost a lot of family members, they've lost friends to this disease. So if you think that there are certain people who are prone to such tendencies, maybe just it's okay. Even if they are suffering from COVID, that's okay. You can also call them. You can also check on them. You can send them their favorite movie. You can send them, their
yes.
favorite food to eat actually. So I
Yes,
think yes, that's
you can do that, or what you can do is you can arrange times of the day, like maybe in the morning, in the afternoon, in the evening, 3 times a day. You can have a video call with your loved one in he's in his room. You can open the door of the room at times, and you can from a distance you can wave good hello or ask about that how that person is doing. Make a live call to that person, and keep an eye on them, and you can give them their favorite movie that like you suggested. You can give them good clothes to wear. They can dress up in their room even if they are there for 14 days. They can dress up well, and talk to them, often, and encourage them that they're going to be out of this situation soon. And this is everybody's, most of the people who are going through this COVID situation, they do fall for depression, so
true.
I
You
yeah,
know,
so
the
it's
depression, and it's the overall pressure कि हाय मुझे कोविड हो गया, how am I going to get out of
yeah,
it, how am I going to get well?
yeah,
Because I have had a very close person actually go through
yeah,
COVID, and she was actually not really sure actually whether she would survive or not. Well, she was okay, she was fine,
yeah,
but she was kind of constantly under a panic attack that how will I get out of it. So I think family support really plays a important vital role.
yeah,
And if even if you're living alone, people like in Karachi there, and then even in
yeah,
Lahore and Islam, people
yeah,
are they're far away from their homes, they are settled elsewhere. So even it's as a tip for them, do not get bogged down by this that you have a very major illness. Please take this as a normal thing, and just
yeah,
take extra precautions and take necessary precautions and get along. So I think yes,
yeah.
precaution and care is like all what we really need to do. The rest Allah Taala पे आप
बिल्कुल
छोड़ दें, अल्लाह ताला basically
बिल्कुल
uh, जो
And
है वो
I just want to add one more thing that what majority of our people in our society, they think it's a big taboo. It's like the medicines that the doctors give for mental health, to treat depression. What they do is that they would agree to what the doctor has said regarding the psychotherapy or any other therapies that the psychologist has suggested, but they would not agree to have the medication. So like all the systems in our body, for example, the heart, the kidneys, the blood, the eyes, all these organs, they fall sick and they need medication. For hypertension, you do take blood pressure medicine. So if your mind is
yeah,
falling sick, you need to help it. You need to take it out of that. And it's not a taboo. It's not a bad thing. It's just a part of your body, and it's giving you alarms. So you need to listen to its alarms, and then you need to take the medicine as prescribed by the doctor. You can't leave the medicines which are prescribed by the psychiatrist or your doctor for mental health. You can't leave those medicines on your own, because they have great repercussions, because they need to be tapered, they need to be stopped in a certain manner. So if you stop them suddenly, because I know people who take these medicines, and then one fine morning they say, oh, like, we are fed up of taking these medicines and we're not going to take them anymore. So what happens is that they have a bad relapse, वो उससे भी बुरी हालत में चले जाते हैं, और फिर then those same medicines don't work anymore. तो आपको दवाई अगर लेने की जरूरत है तो आप दवाई लें, आप ना घबराएं, कुछ नहीं
exactly.
होएगा,
डॉक्टर
you will get
प्रिस्क्रिप्शन
better.
पे लें,
बिल्कुल,
medicate, do not put
हाँ,
yourself
सेल्फ
under
मेडिकेट नहीं करें,
lot of
अपनी फैमिली की सो एंड सो की मेडिकेशन पे नहीं रहे, दैट दिस मेडिसिन सूटेड माय खाला का बेटा, सो इट्स गोइंग टू सूट मी एज वेल. नो, you need to seek your medical help, and your doctor will prescribe you medicine according to your needs. and according to the
True,
intensity of your problem. So
true.
please don't fear seeking help. हर बंदे की जिंदगी में कोई ना कोई परेशानियां मुश्किलें आती हैं जिसकी वजह से वो बंदा परेशान हो सकता है। आपको जरूरी नहीं है कि यू डोंट नीड टू बी ब्रेव ऑल द टाइम। हर वक्त मतलब हर इंसान बहादुर नहीं हो सकता हर वक्त।
Okay.
ठीक है,
Yeah, it's
कोई
okay.
बात नहीं, इट्स ओके। इट्स ओके टू क्राई, इट्स ओके फॉर मेन टू क्राई। आई इवन टेल पीपल हु माय द पेशेंट्स हु कम टू मी हु आर men, I said it's okay, this is the wrong thing that men can't cry. Why can't they cry? They have emotions, they
They
feel,
have him.
so they can
Yeah.
cry. But if you're crying it's prolonged, you need to seek medical help or at least talk to a friend of yours.
True, yes, just like I'm talking to you right now.
I feel so
But
good talking to you, Mavish.
oh yes, it's wonderful reconnecting with you, and thank you so much for such an insightful
Thank
discussion,
you. Thank
guys.
you.
I hope we managed to get we managed to talk about some things that have not been really spoken commonly, and let's kind of just take each step at a time, and let's just kind of try to deal with our conditions our very own way, and help towards more towards resolving them rather than carrying them on and carrying their burden all along, basically. So,
Yeah.
Anusha, you practice in Lahore. Are you open to? I don't know if anybody here wants to get in touch with you. So, are
Yeah.
you open for online?
Yes. Mavish, I'm available for online consultations. If anybody wants any kind of help, seeking any kind of medical, physical, any kind of help, I'm there. I'm there with for online consultations as well. All you can do is follow me at Dr. Anushe Usman, Dr. Usman, on Instagram and Facebook, and just send me a DM, direct message me, and I just get back to my people, whoever contacts me within like an hour or something. So yes, you can come visit me, or if you don't want to come, I can always arrange an online consultation, and we can talk about any problems that you are facing, be it physical, mental, social, or psychological.
That's perfect, guys. If you have any other questions or queries, please you can reach out to both of us. You
Yeah.
can reach out to me on Insta K with the K Mavish as my Insta name, and also you can also reach out to Anushe, and she goes with the Insta handle of Dr. Anushe Usman. So I think we would like, I think Ahmed has a point. Yes, yes, Emma, that's the plan. We would invite Alina Kareem. Of course, I just started doing these live sessions so that I can help out maximum people talk about things that matter them the most. So yes, you stay tuned to this space, guys. A lot of the exciting things are happening, and Anusha and me, we would also be doing a lot of sessions together, and we will talk about
Yeah.
issues. If you guys want us to talk about a specific issue, please do DM us, and we'll be able to take care of it. But till then, guys, you have an absolutely wonderful Saturday night, and and of course Sunday, and let's be ready for to take on the world on a busy Monday. So here is me and Anushe. Thank you so much.
Yeah.
Of course, I have no words for you. You've been like a
Thank
pillar of
you.
support. So thank you
Thank
so much, Anushe,
you.
for your time, and I hope to catch up with you soon. So, guys,
Yes,
here is me.
I'll be looking
Signing
forward.
off. Yes, and here is me and Anusha signing off. We'll stay in touch, and do remember us in your prayers. Thank you.
Thank you.
Bye.
Thank you. Bye. Bye. Bye.